We depend on medical research to make important decisions about our health care. And now there are some faculty members at Johns Hopkins that are saying that our funding is diminishing. And do you really believe that?
Well, there are problems with funding. I mean, first of all, the experiments that we're doing in medical research are costing close to $500 million each. So you're looking at $500 million a lot of the time being spent. The pharmaceutical companies are less likely to want to do that research, but then they're really stuck behind the eight ball because they got no choice. They have to. And then we're looking at less pharmaceutical investing in this, and then there's some cuts in federal funding that are coming out of Congress because we don't have enough money. You know, we've got this economic crisis we're
facing. It seems like they're kind of leaning in this article about having the private sector fund medical research.
Yeah.
But on the other hand, if they start doing this with bonds and funds and all that sort of thing, then the public would have an investment in the outcome of the study too, wouldn't
that
they?
might actually work. You know, having bonds isn't a bad idea because then the conflicts of interest wouldn't be there because this would be money that would be dedicated for a certain thing called research. But if you're talking about getting private investors involved and there's return on investment, then it becomes another issue that I'd worry about a lot. And we don't really need more medical research as much as we need high-quality medical research. And that we don't have. And that's based on statements that have been made by 3 chief editors of major journals in medicine. One, the New England Journal of Medicine, where Dr. Marcia Angell, who's a doctor from Harvard, was a chief editor there for a number of years. In fact, she was affiliated with the journal for about 20 years, quit her job saying she couldn't stand the low quality of information that was coming across and being published in the New England Journal of Medicine.
This is terrible, you know, because our health care depends on what comes out in this research. I mean, your
Absolutely.
doctor is reading these articles and deciding how to take care of you because
Based
of
on
what's
that.
what's in the art and the research.
Exactly. And it's not just Marcia Angell. There are 2 other people. Catherine DeAngeles, who is still the chief editor of the Journal of the American Medical Association, has published just a scathing of statements saying there's a problem here. She's staying there trying to make it better, but she's got her hands full. And then there's Ushma Neill, who isn't an MD, but a PhD, that's the chief editor of another major journal, coming out saying the same thing. So there's consensus amongst the chief editors of at least 3 major journals saying that we've got problems with the quality of research. So what we need to do is take the conflicts of interest out, which means that we need another system. We're looking at 32...
We need a lot of money.
Well, money, yes, but money that comes untainted. The problem with medical research today is that we spend about $32 billion to the National Institutes of Health, and unfortunately, the pharmaceutical industry has strong, powerful connections with the National Institutes of Health, and so you have there conflicts of interest that you'd like not to see. And so,
well, currently, doesn't NIH spend something like $32 billion a year, and the big pharma spends about $60 billion a year on medical research? So we're talking.
So you know
money.
You can't trust either one of those sources really, but you can trust the information that comes out of big pharma's research less, because they have clear conflicts of interest. They go out and spend a few $100 million on a study. What do you think they're gonna do? They're gonna make sure that they milk that study for everything they can, even if it turns out not to show something that's important and valuable. In fact, they even lie about some of the things and withhold information from us because they're a business first and a service provider second.
And like with Vioxx, sometimes what happens is it's worth it for them to lie, even if people die financially, because then they make more money than they would than they spend on the lawsuit. In other words, so
right,
even
so
if they're sued, they still don't have to pay as much money as what they've made on the drug.
All right, so it's that real simply. They basically went into a situation where they knew they'd kill about 50,000 people from heart attacks and strokes. Withheld the information from the FDA, at least that's how it seems. We don't think that the FDA was complicit, but who knows. And then all those deaths occurred, and about 5 years after the drug was on the market, they voluntarily took it off before the FDA was pressured to remove it from circulation. So they knew that. Now that's not just making a decision that's a financial decision. That's making a decision that's costing people their lives, about 50,000 people their lives. Now that's murder, and that should be charged as that. But that's what happens when you have money as the first matter of importance, and you have service as something that if you have it, that's fine, but if you don't, it doesn't stop you.
We all know people kill for money. Just watch TV.
Well, just look
Turn
at the
it on.
Vioxx story. There you are. So we need a system whereby the National Institutes of Health should be regulating research. And if research is going to be done by a group of people like the pharmaceutical interest who have conflicts of interest, that should be a second level of research that we don't trust because they've proven that they can't.
Okay, so the pharmaceutical companies need to have the research done.
They have to have it done, or
what
they
if,
can't come
So
out.
what if they pay the government, and then the government pays NIH to do the research?
Yeah.
And this way, they don't. The pharmaceutical companies don't interpret the research.
So what you're saying, I think, is a great idea, and that's basically have NIH do the studies, and have the pharmaceutical industry pay for it, but not to the NIH. They should pay it to the U.S. government because we don't want any conflicts of interest between the NIH and the pharmaceutical industry, because that's what's happening with the FDA. And we know that 25% of FDA funding comes from where? The pharmaceutical industry. So if the money comes into the government, and the government then independently funds the National Institutes of Health, you'll get good solid science because there are no conflicts of interest. So this article is trying to convince us to support more pharmaceutical industry research. I think that medical research in general needs to be honored, but it needs to be research that we can trust. We can't trust what's coming out now based on what we're seeing in the major medical journals, according to the people who I've just told you about.